Hello students. Today we will discuss about the terminology of body movements. In our previous class, we have discussed about planes and axes. Planes, the place or surface upon which movement takes place, and an axis is a straight line around which an object rotates. Movement at the joint takes place in a plane about an axis. Axis and plane are perpendicular to each other. We have discussed it earlier. Plane regarding coronal axis will be sagittal. Regarding plane to horizontal is vertical axis. Plane regarding sagittal axis is the coronal, or we call it frontal plane. Let's have a look on the objective of today's class. The objective of today's class is to study about the movements associated to body. We will discuss about the upper limb, lower limb, trunk and mouth movement. We have an objective to learn and understand the terminology of our body movement. So, begin with the movements of upper limb, lower limb, trunk and mouth. So, with a quick revision about the review of the movements of upper limb, we have flexion. Flexion is when two flexor surfaces are brought close to each other. Example in elbow joint, when front arm is and forearm is opposed to each other. Then it is extension, when extensor and dorsal surface are brought in as much as approximation as possible. Abduction, when limb is taken away from the body, and adduction are when limb is brought close to the body. There is all movement combined together is called as circumference. Then medial rotation. When the arm rotates medially, bringing the flexed forearm across the chest is called medial rotation. Here it is. When arm comes inside towards the chest, it is called internal rotation, or we called it medial rotation. Lateral rotation. Lateral rotation, when arm rotates laterally, taking the flexed forearm away from the body. In this picture, this movement is called as lateral rotation. Then another movement is supination. When palm is facing forward, this is supination, or when palm facing backward is called as pronation. Adduction and abduction. When all digit finger get together, it is called adduction. Abduction, when the all fingers separated. Apposition of thumb. When tip of thumb touch the tip of all other fingers, it is called apposition. Circumduction of thumb. Circumduction of thumb is all the movements combinedly together done by the thumb, then it is called as circumduction. Now, movements on lower limb. So, the movements of lower limbs are flexion of thigh, when the front thigh comes in contact with the front abdomen. Raising the leg towards the abdomen is called as flexion of thigh. Extension of thigh, when person erects or in standing position or in supine. Abduction, when thigh is taken away from the midline. And adduction, when thigh is brought close to midline. This is midline of the body, and away from the midline is called abduction, and coming towards the midline is called as abduction. Then medial rotation. When the thigh is turned medially, it is called medial or internal rotation. These rotations are considered with the ball and socket joint of shoulder or of hip joint. When the ball of humerus or the ball of femur goes in to inside, it is called medial or internal rotation. When the ball of humerus or femur goes out the body, then it is called as external or lateral rotation. Flexion of knee when back of thigh and back of leg comes in opposition. Extension of knee when thigh and leg are in straight line as in standing. This is the extension of hip. Dorsiflexion. Dorsiflexion of foot when dorsum of foot is brought cross to front of leg and sole face forward. Plantar flexion of foot when sole of foot and plantar aspect of foot faces backward. Inversion when medial border of foot raised from the ground, and eversion when the lateral border of foot raised from the ground. So this is what we called as the movement on the lower limb joints. Now next, rotations or side flexions. So here is the movement on neck. We have flexion, we have extension, we have right and left side flexion and rotation. So here lateral deviation, the opening of mouth, the lower jaw and lower jaw is lower to open the mouth. When we used to open our mouth widely like ah is called as opening of mouth. It is called as elevation. Oh, sorry, depression. Then closure of mouth, that is called as elevation when both jaw bones are coming close to each other. Protraction when lower jaw slides forward in its socket, and retraction when lower jaw slides backward in its socket. And side by side movement is called as the lateral deviation. Yes, backward bending is called as extension. Forward bending is called as flexion. Sideways movement bending is called as lateral flexion, and side rotations are called as lateral rotation. So these are the movements found or possible in the trunk. So here is a quick summary of all the movements we have studied. We have studied about the movement of upper limb. We have studied about the movement at shoulder, elbow, wrist and finger joint. And we have studied about the movement in lower limb, that we have knee joint, ankle and foot. We have studied about the movement in neck, TMJ and trunk. We have understand about the flexion, extension, abduction, adduction, some rotations, pronations, supinations, eversion, inversion and different kind of other movement. There is one more movement called as circumduction, which is the combination of all these movements, which is possible in shoulder and hip joint. One more in the thumb also. Here are the references for your help. You can review these references to make your understanding better. I hope you understand this lecture and it will benefit your knowledge. Thank you.